Okay, Social Services and Housing Committee meeting to order, and I have anybody declare pecuniary interest either now if it arises down the agenda. We have three action items. 2A, approval for reserve fund expenditure.
We have a report before you where we're asking for approval to withdraw an amount not exceeding $4,000 from the Darrell Young Reserve Fund for our 2017 Christmas program, just to be on the safe side. We do have donations that are still coming in, but we just want to be prepared if we ultimately didn't have enough for the full program, that we'll pull that from the reserve.
Staff recommendation, mover and seconder. Mike, Robert? Are there any further discussions? Mike?
Just how would you apply for that, and how many people take advantage of it, Christine?
Each year the number of children that we serve varies. It's in the hundreds, and it's coming from our caseloads. So,
Okay.
So there are people that are already on our program. So whether they're child care fee subsidy family or on Ontario Works, and we can come back and give you a little bit of a summary in the new year if.
That's fine. I mean,
Okay.
Thanks. I appreciate it.
Were you thinking of more, Mike? Like, were you thinking of giving more, or?
Interesting. Remember, I mean, I think if you find that you need more, I'd say by all means come back, because I think we could be.
It's kind of what I'm thinking as
Yeah,
well.
if you do need more, I suspect you probably have a pretty good handle on it. But if you need more, I would certainly support an addition.
Is this something that you would need approval before Christmas?
I'm really confident that the $4,000 will be sufficient for this year,
Okay.
because the elves have done their plan and,
Sure.
and know what they're purchasing. But it's helpful to know as we continue to expand in new ways that next year, if we're looking at a different group of numbers, that we take that into consideration then. So thank you.
Okay. All right, any other discussions? All those in favor? Opposed, if any? That's carried. Thank you. Next item.
So the Housing Services Manager has a report before you here. The Community Delivered Rent Supplement Pilot Program was an initiative that was on our 2017 business plan. And we did hold an expression of interest, and we had a few candidates apply for that. We had a staff evaluation that had members from finance and from planning and development, and also from Human Services Department. And the YMCA of Owen Sound Grey Bruce was the project that the committee is recommending go forward for our first pilot for this program. And so we are seeking permission for bylaw to authorize the warden and clerk to start a contribution agreement so that we can move into that program. And we do have the guidelines for the program attached as well. I'm happy to take any questions if there are any.
Do I have a mover and seconder for staff recommendation? Anne, seconded by Mike. Are there any further discussions? Hearing none, all those in favor? Opposed, if any? That's carried. Thank you.
Sorry, I missed one. There we go. No.
Yeah, I think there was a third action item.
Yes, it's got a big agenda today. There we go. Okay, so this action item that we have before you is with regard to our speech and language service agreement that we have with Thames Valley Children's Centre. As we've been transforming and modernizing the childcare programs, some of the programs that we've provided in our community don't fall directly under the childcare or Ministry of Education piece anymore, but fall under programs such as health. Speech and language is one of those items, and so the report that we have before you is showing that we are going to, over the next couple of years, decrease the funding that we're providing in that area. That 2-year transition will give time for them to look at how they provide, continue to provide speech and language services without the funding that they're receiving from us. And so we do have an agreement before you as well too, that we're recommending that we introduce this new agreement effective January 1st, 2018.
Mover and seconder for staff recommendation. Anne? Robert? Are there any further discussions? Anne?
Sorry, I maybe missed it. So you say it's a transition, and so previously, so I'm thinking speech, and you have early child care. The schools take kids now at 3, so is this speech, you only need it for, like, I just don't understand the need at early years when the schools start at age 3 and 4. It's just, if it's, you know, children, like I had one son that didn't speak till he was 2, you know, and then he spoke fine. But I just wondered who the clientele are at that early age.
Sure. So typically what it has been is this funding's been flowing through our sub-program of special needs resourcing. And so our staff are working with families and childcare centers around setting up objectives and programs for children that have 2 areas of delay. Sometimes one of those areas of delay is speech. And so having this funding available has allowed us to do a direct referral process where we're helping those kids get the speech and language service that they need before school. So this is preschool services. And so really though that speech and language piece does fall under Ministry of Health, and so there's discussions now in transforming both of those systems and making sure that we're spending the dollars that we receive in each system specifically on the area that we need. So we're being asked to redirect the funds that we have coming to us under our childcare allocation to the childcare piece specifically, but we want to do that in a careful way so that we're not discontinuing service immediately. So it's a transition to move from the $26,000 that we had been funding them down to 0 over a 2-year period.
Okay, so community living, I can just speak for our local one over the years, has always had kind of an infant development program. Does that dovetail with under health now as well? And I was just wondering how that worked, because they would start, you know, with them very young, trying to get the sounds out, moving their tongue and everything else. And so it was, I'm always concerned if there's duplication. And it's great that, especially in, with ones, like you say, with 2 areas of delay, that they're identified early because you know they're going to need help. So I just wondered how that worked too.
So some of the funding for some of the programs also comes from Ministry of Children and Youth Services as well too. So the infant development programs are still functioning in our community, and our special needs resource group work closely with them. So depending on the criteria, which program is more appropriate for them to be in. Generally, the way that we look at it is that as soon as a child's in a child care center, they become our client. So infant development more primarily works with children that are at home with stay-at-home parents as opposed to being in the child care center. The special needs review, though, across the province for children is still underway. And so they're looking at a number of those different pieces. And so I think over the next year or so, we'll hear more about what the future is and how we relate to those different programs.
To make sure that it's kind of seamless. And, okay, thank you.
Okay, any other discussions? All those in favor? Opposed to any? That's carried. Thank you. Information items.
And at the chair's request, if there's anything you want me to speak to, otherwise I know you had a concern with the weather too. So,
Anne.
We're pleased with the Russell Meadows development. I think it was quite needed, and I walked past the other day, and it's well on its way and being implemented. So I think the biggest thing is the nature of the building. The others are like 2 stories, and it's 1 story. So it will be a good fit for our needs in Kincardine.
Any other comments or questions on any of those 3 information items? Next meeting, January the 4th. Motion to adjourn. Mike, Ann, all those in favor? Opposed to any? That's carried. Thank you.